as I indicated earlier, is that the pandemic is impacting negatively on the revenue base of the municipality. And so the whole issue of municipal financial viability is emerging as a major policy concern for at the local government sphere. Slide 31. So given the pandemic, given the response and our response as government, what are some of the observations and lessons that we can draw from this close to 3 to 4 months experience of this particular pandemic? One is that we've been fairly consistent with the Constitution in the sense that we have sought to uphold what the Constitution is saying by guaranteeing all inhabitants a certain minimum living standard to respond, to the shocks of the COVID-19 lockdown, particularly on the lives of the poorest of the poor. Okay. The fact that there may have been challenges around the distribution of food parcels, that is acknowledged. The fact that we can actually coordinate our activities better between different departments in national government and across the 3 different spheres of government in the country, that is also acknowledged. And the fact that we can actually coordinate our activities better between government and other and non-profit organizations, that is also acknowledged. The second point is that effective leadership has been provided by the president, who has basically been the face, of fighting this particular pandemic together with his cabinet. There's also national support for government's COVID-19 interventions. There's overwhelming support that when the lockdown actually started, from civil society, from all sectors of society. Yes, people may be fatigued by the lockdown. The fact that we are now at level 2, people may be fatigued. Yes, there may have been one or couple other challenges of wanting to take government to court for whether it's a cigarette ban, or whether some people felt that the regulations were exceptions and not the rule, but there has been overwhelming support, by society with regard to government's strategies to fight this particular pandemic. The health sector also has shown that the infrastructure that we have is actually, up to scratch. Yes, there may have been instances where particular, hospitals or clinics, were experiencing, challenges, but on the whole, the health infrastructure and the institutions that we have within the country, are up to task. The economic systems, it's important to indicate that the economy has actually been severely affected. Even if though we actually have this 10% of the GDP.
DTG, my apology. It's important to note that we've got no minutes. Thank you. Suggesting that you try to wrap up.
All right.
7 minutes gone. Thank you.
All right. If I can just conclude, Chair, by indicating that there are a couple of lessons that we've learned as government, where